Hi, this is Stephanie Bolton with Healing Sounds Music Therapy, and today I wanted to talk to you about guided imagery and music, or GIM for short. It's the subspecialty that I have specialized in music therapy, and I get a lot of questions asking me about exactly what that is and what it involves. So I just wanted to take a few minutes and explain it to you. So, kind of the history of GIM is that back in the 60s and 70s at the Maryland Psychiatric Institute, there was a group of psychiatrists, psychologists, other mental health professionals who were doing research on some of their long-term serious patients. And these were folks who had been admitted to the institution for long-term care. They had diagnoses like schizophrenia, psychosis, major depression, those kinds of things. And the researchers were doing these studies. They were giving the patients controlled doses of LSD. And their thinking was that they knew that LSD had some capabilities of changing the chemicals and the makeup in the brain. And they were trying to sort of draw that line between how do they change the makeup of the brain in positive ways. So they were trying to therapeutically use the LSD with these patients to try and combat their mental illness. So there was a woman who worked there named Helen Bonney, and she was a violinist and a music therapist, and she was tapped to be part of their team doing this research. So she was including music in with these LSD experiences of the patient. So they'd start tripping on LSD, and she'd use the music, and they would keep track of, what the patients were experiencing and how they felt, and use that information as a way, as a therapeutic tool to help them deal with their problems and their diagnoses and their coping skills. So eventually the researchers had to stop using LSD for their research, and what Helen Bonney discovered was that she could continue having those positive outcomes with the patients using only the music. So she continued her work, and she developed some very specific music programs, which were, 4 to 6 pieces of classical music. Because she was a classically trained violinist, that was what she knew, that was what she had used. So she would develop these programs of 4 to 6 pieces of music, and she'd string them together. She'd carefully choose the music that she included in a program, and these programs had a very specific purpose. So she developed some for dealing with depression. She developed some for the different stages of grief. There's some for anger. So she really covered a large spectrum of emotional states with her music programs, and she started using them with the patients. And had some good outcomes with that. And people were starting to notice that she was having success here. And so there were some training programs that developed as a result. And other music therapists, other mental health professionals wanted to learn about GIM. So there are training programs, a handful of them all over the United States. There are some in Europe, and basically it goes through 3 levels. There's level 1, 2, and 3, and in its entirety it takes probably 4 or 5 years to go through the entire program. And at the end of successful completion of that training program, you're a fellow in the Association of Music and Imagery. And that just means that you have completed all the requirements, you understand all the music, you know how to use it correctly, and that you're allowed to do that kind of therapeutic work. So I hope that answers your questions about GIM. If you have any more, you can always send me an email or call me at 256-655-0648, or leave a comment in the comment section under this video, and I will be happy to answer your questions. I hope you have a great day. Bye-bye.